but I knew something was wrong, and I was trying to ignore it and just move on with my life. So I was your typical post car accident guy. I just wanted to rub some dirt on it. I knew I had a bad concussion. I had lost consciousness for quite a few hours, but I knew something was wrong, and I was trying to ignore it and just move on with my life. For example, every time I went from laying down to sitting up, the room would spin for about 20 to 30 seconds. When my daughter came to me, and when she came to me and she said, "Dad, something's wrong. You're usually happy. You're not yourself." That's what I needed to hear to go get the help that I needed.
The intention of the Leon Haley Brain Wellness Program is to provide state-of-the-art care to those who protect our nation and our communities, namely military veterans and first responders who have sustained TBIs, or what we call subconcussive injuries, to optimize their neurological function, their cognitive function, and their mental well-being.
The case managers meet with the patients before they come through the 3-day assessment, before they come for the 3-week IOP, and then post-IOP for a year.
Through physical therapy, we're having the body help heal the brain. And a lot of that's done by introducing a lot of different sensory challenges to the body. Through those challenges, we are able to better improve that brain, improve the brain's ability to receive the information within their environment to help them out. We do some generalized exercises as well, because we know through general exercise, we also improve cortical health. We improve the neurotransmitter productions, we improve the blood flows, we improve all these things because we know through evidence a good healthy heart also produces a good healthy brain.
I think when people come in, they're very apprehensive with art. And I love to see the growth where they're able to tap into their emotion, they're able to use art for self-expression, and they're letting out things in here that they may have never talked about before in their life. The artwork itself keeps them present, and it keeps them grounded and in the moment. So it's a unique form of therapy because it keeps you self-aware while you're working with something difficult.
As a neuropsychologist, I'm involved in the evaluation and rehabilitation of brain injury and brain-related pathology. And as research director, I'm also involved in examining our data, our outcomes data across the different disciplines in order to really optimize the treatment that we're giving.
So my job is to go out and to make as many relationships as I can with other organizations so that they understand what the Haley Brain Wellness Program does for veterans and first responders. So in turn, they would recommend us to their friends or get us or talk to them about what we do and have them contact us so they can attend our program.
One of the things that we're doing in this program is helping them to harness the resource of their attention and be able to direct it. So if they can direct it, they can also focus it and be really much more able to tolerate emotions like anger, disappointment, irritation, annoyance. They can tolerate those emotions, regulate their nervous system a little bit so they can respond differently in situations.
A lot of times a person thinks speech is just saying your R's and your S's. So we start by just explaining what is speech therapy. We look at hearing, reflux, voice, swallow. A lot of people, they've had burn pit exposure, so maybe they have respiratory issues. Cognitive communication, social communication is critical. And so to evaluate and see, okay, if a person's forgetting something, they're losing their keys, or they can't start or continue conversations with a friend. So that's my opportunity to evaluate that and figure out how we can make it better.
When people come into this setting, they say this is one of the most relaxing sessions they have because the first session is listening to music and getting to know what their preferences are. After that, we decide, should we try to write a song together? Is there something that we need to work through emotionally that you would like to express through music? Because it can say a lot more than words by themselves might not be able to.
The goal of the Leon Haley Brain Wellness Program is to reach as many veterans and first responders in the community that we can. It is estimated that 20% of all veterans have experienced a traumatic brain injury. And of that 20%, 85% are mild to moderate. Our goal here at the Brain Wellness Program is to reach out and build partnerships in the community to help funnel our veterans and first responders into the program. I went through cohort 3 in 2022 and with 3 other Navy veterans. And to this day, they're my best friends.